Now for up next, we are trying to look at the next vein in the lower limb, which we are going to discuss its anatomy, and this is what is known as a posterior tibial vein. So let's try to identify the vein here. So looking at this image, what we got here is a posterior tibial vein. So the posterior tibial vein, we said that let's identify it here too. Okay, posterior tibial vein. So for the posterior tibial vein, we say that they are actually paired veins. So they are usually together. So they accompany the posterior tibial artery and they drain blood from the back of the leg. That's the posterior of the leg. Also the plantar surface of the foot and the medial ankle. So the posterior tibial vein is formed by the union of medial and the lateral plantar veins in the foot. So down here, though not labeled well, but you can see the medial plantar vein and the lateral plantar vein. They are the ones that come together to form the posterior tibial vein. Okay, so it ascends in the posterior compartment of the foot, accompanies the posterior tibial artery, and travels between the flexor, digitorum, longus, and the tibialis, posterior muscles. So it unites with the anterior tibial veins at the upper border of the popliteal muscle to form the popliteal vein. Okay, so tributaries. It gives rise to the peroneal or the fibular veins. Okay, gives rise to the muscular branches and the nutrient veins, then communicating veins. Okay, so drainage, it drains the plantar venous arch, it drains the posterior muscles of the leg, taking out bad blood, also the fibula, the tibia, and the ankle of the foot. Okay, so we'll learn about the anatomy of this vein because it could be affected by deep venous thrombosis, could be affected by what we'll learn about it so that we can get to understand venous return, how it is important in imaging, and also collateral circulation.